Welcome to the Sustainable Clinical Medicine podcast. I am your host, Sarah Smith. I am a practicing rural family physician and the charting coach. This is the podcast for physicians and advanced practice providers who are ready to step back from the busyness of their clinical day to share ideas, question everything, and redesign their clinical day. We are redesigning clinical medicine to create sustainable clinical days and create time for our lives outside of medicine. Join us for discussions with world experts who are helping design sustainable models of clinical medicine and the physicians or clinicians who have discovered or designed sustainable models of clinical medicine for themselves. All right. Hello, everybody, and welcome back to this week. Just a reminder before we get started, October is our birthday month for Charting Champions, which means that we usually have something very special going on. And this year we are going to be inviting our newest members to a charting adventure. We're going to get together in November to spend a whole morning figuring out how to get your charts done after every patient, for all the different types of physicians joining the Charting Champions program this month. So make sure you check that out. So welcome to Dr. Latifat Akintade, who is currently out of country, and we're going to hear all about that. I'm going to let you introduce yourself and welcome.
Thank you for having me. I think last time we talked, you were on my podcast, so it's nice to come visit you in your own home. It's a pleasure to be here. I'm Dr. Latifat. I'm a physician, a gastroenterologist. I'm also the mama of three little ladies. I'm married. We're currently in Nigeria. This is the 15th country we've been in since April when we started our sabbatical. And I'm also the founder of MoneyFeed MD, which is a platform, includes a podcast, a book, an educational course, which is what we do is really educate and empower women physicians to have money so that we can live the life we want and not burn out inside or outside of medicine.
Amazing, amazing. So you're in Nigeria, and did you say 15 countries since April?
Mm-hmm.
Oh my
Yes.
goodness. You are more adventurous than we are, and I thought we were pretty adventurous.
Well, it wasn't in the plan. We weren't going to do 15 countries. Our plan was maybe 9. But what we did was, and I know we're going to talk more about the sabbatical, was we asked ourselves the question of what did we want in our life that we haven't had ever or in a long time? And that was flexibility. So we allowed a lot of flexibility. And so the flexibility is literally what led us to having this many countries, because we're like, let's go to Morocco. Sure, let's do it for 10 days, right? And those other things. So it's been great. I'm super grateful that we're doing this.
Oh, I love that. That's so fun. Okay, so tell us about your journey through medicine and what ended you up in GI. So tell us about that.
Absolutely. So I grew up in Nigeria and moved to the US about 20 something years ago. At that point, we moved, my parents lived in Nigeria. My siblings and I moved. We were in LA, lived with some family members there, and eventually kind of migrated towards the northern part of California. So I did undergrad in LA, med school in San Francisco, and then residency in New York, and back to California for fellowship. My goal was to be a physician. That's all I knew. I did not know what kind of doctor or anything like that. But when I was in medical school, I had a sense that I was maybe going to do primary care. So if a lot of your people are primary care doctors, they're my first love. I thought I was going to do primary care. And the reason why I wanted to do primary care was because a lot of the experience and exposure that I had in medicine was to primary care doctors, pediatricians and internal medicine doctors as well. And so when I was in even first year and second year of med school, I thought I was going to be primary. I could not wait to be a primary care doctor. So now imagine the shock of my life when I did my surgery rotation, and I loved doing procedures. I loved being in the OR. And I loved reading about freaking diverticulosis and diverticulitis. And so I had this existential crisis where I freaked out, found one of my mentors, and I was like, oh my goodness, I love this thing and I don't know what to do. And it was like, well, I'm not a surgeon personality. I'm more of like a primary care, internal medicine personality. And then he said, well, what about GI? I'm like, GI? So that's how I found GI. And honestly, I'm really grateful that I did. I love what I do with GI. I get to serve my patients and I get to serve my doctors as well. Like our primary care doctors are, the people that consult us. It really is a pleasure to partner with them in taking care of their of patients. So what I was doing prior to my sabbatical was GI with an emphasis in IBD, so ulcerative colitis and Crohn's disease in a large hospital system. And, a lot of the stuff that I care about is like disparities, decreasing racial disparities. And being able to do that even as the GI doctor really has been something that I'm grateful for. So that's my journey through GI.
Oh, wow. There we go. That's fascinating. I know that a lot of GI is not necessarily all procedures. There's a lot of educating patients as well. Was there anything about, like, you moved country, you moved to a new culture? Like, tell us about that experience. How did that go?
That was honestly, it was shocking. It was hard,
Mm,
right? Because here I was. I mean, I literally started college in Nigeria, in the US, excuse me, a week after we moved to the US. And our parents were not with us at that point. So imagine going from like talking to your parents about the headache you had, and they would give you medications like the Tylenol equivalent, to really being on your own. It was hard. And I did not know anything about the educational system. I did not know much about racism because I grew up in a culture where we mostly looked, or at least understood, each other, right? So those were some of the experiences that I had to learn about when I got here. And I actually really remember when I started in a community college and found out that to get into medical school, you would have to apply the year before you graduate. I did not know it was a year before you graduated from college, like a 4-year college. I thought it was like even 2-year college. So I freaked out, ran to the advisor's office, and I'm like, oh my goodness, I missed the deadline for application. And it's like, okay, let me sit you down and tell you how to apply to medical school. So I had to learn a lot, but honestly, as hard as that journey was, and it was hard, honest to be on a more serious note. I mean, there were days when all I had was like 25 cents popcorn the
mm,
whole day of like morning through night in school. When McDonald's had their buy a Big Mac for 99 cents with your ID card. That was like one of the best seasons of my life. So things were hard, but now when I look back, I'm honestly, it's all part of what's made me who I am today, the resilient person that I am, the resourceful person that I am, the person that values the money that I have as a gift to live my life and be a blessing to others. So I don't regret any of the things that I went through, but it's also just made me a better, more textured person and more appreciative of the life that I get to live today.
mhm. We have that understanding that there's a real divide between kids entering medical school, the ones that have really worked hard to get there with very little income, ones that may have been supported by parents or other kind of scholarships or something. What does that look like when you actually enter medical school for you?
To be honest with you, I mean, I went to UCSF, and UCSF really prides themselves in attracting very traditional people. And our class was like super diverse in every way, socioeconomics, racial, experience, age. I mean, Al Gore's daughter was in my class when we started medical school. Like we had the whole gamut of people. But one thing that like with any groups that you're in, eventually you guys end up your people find themselves, right? But I do have to say that because of the kind of medical school that I went to, averagely, most people were open-minded, were willing to learn, were willing to get educated. And I think that really affected the experience that I had positively. And hopefully I did the same for them as well.
Yeah. Were there any supports that you had as you entered, or even to get into medical school?
Yeah, mentorship has always been a huge part of my life because without mentorship, I would not be where I am today. I mean, again, I knew zero. I didn't know what an MCAT was. I didn't know what anything was, right? And so for me, the people ahead of me have always been people that I leaned onto to help me learn. And so that is continued to be an important part of my life. So even when I transferred from a 2-year college to a 4-year college, I was mentoring those behind me. I still remember the first time my first mentee got into medical school was like one of the happiest days of my life, right? And I continue to do that in different capacity even till now. I mean, now I do that with finances because I think about myself as like a financial, coach, but also like a mentor to people. And it's been a core part of my success. And it's something that I know that I want other people to have as well.
Yeah, yeah. How was it entering into the clinical years of medicine? What did you find then?
That was hecka hard for all of us, right? It was hard. I would not lie about that. It was hard, but also because now there is things like, racism that we had to deal with. And I always tell people like two of the most valuable things that I got from medical school, apart from my education, are the cohort of friends that I got in medical school that we still are connected till today, and we support each other through, motherhood and career changes and growth and all and failures and success and all that. But there was an attending that I'm super grateful for that I had in medical school who was a psychiatrist and did a lot of like what you would call like mentorship and coaching, really. She did a lot of like relationship counseling for people. And she actually helped us a lot because she would do things like teach us how to communicate, like how to say things on the words, even when people are being racist to you, how to navigate like patient physician relationship when you know that they're wrong and you're right. And the things that she taught me about communication are still things that I use till today. And this is, I mean, I graduated med school 2010. So I still use a lot of this knowledge till today. And honestly, she helped me succeed as a resident, as a fellow, as a parent, and everything else. So I'm super grateful for her. And one of the amazing things we did a couple years ago was many of us that she counseled or coached in my cohort, we actually did an event together, like a virtual event, where we actually had her and another physician that made a hugest impact in our lives. We introduced our kids to them, and we got a chance to just say thank you for the impact that they've had in our lives. So I remember that really well.
That is very special. I don't think I've heard of celebrating a mentor quite like that. That's pretty impressive.
She deserved it. She deserved it. And honestly, I'm really cognizant about our lives and the fact that, my dad died 2 years ago. And one of the things my dad would talk about was the importance of appreciating people when they're alive. Like, don't wait for people to die and then be like mourning over their obituary when you never told them how valuable they were to you. And I'm very cognizant of the fact that we don't have forever to live. So as much as mentors have been important to my life, I always try, and I'm not perfect at this, but I try to be intentional about looking back in the short term and looking back at those that have mentored me and making sure that I get a chance to say thank you to them. So that counselor that I rushed to his house or called him actually when I was freaking out about not applying to med school, I called a couple of years ago. I called the like operator at that community college. I was able to get connected and found out that it was actually retiring that month. So I got a chance to say thank you.
Lovely. So appreciative. And I think that I can hear that in your heart. That's something that you are grateful and appreciative in all areas, which is super fun. Yeah.
Absolutely.
Part of probably things that have helped you through in creating sustainable and resilient. Yeah.
Absolutely. Absolutely. And there's so much bad in the world, right? A lot of us invest, and as physicians, your audience are primary care doctors. They're serving their patients day in, day out. And even if you're not a primary care doctor, you're serving your patients in your capacity, whether you're clinical or not. And sometimes we hear the complaints, we don't hear the thank you. And so imagine a patient calling you and just saying thank you. Like we all can do that. And, it's a gift to give and it's also a gift to receive. And so the way that I think about it is I get to thank them and they get to enjoy seeing the impact of the work that they do in a world where a lot of the most important jobs are actually thankless.
Mm-hmm. Yeah. Tell me about moving to the other side of the country for residency.
Oh my goodness. A boy made me do it.
A boy made you do it.
A boy made me do it. So my husband, now husband, we were dating, is also from Nigeria. we were dating. We had been dating since like first year of med school. So we had been dating for about 4 years at this point. He was trying to move to California, but could not find a job in California. And so I was like, you know what? If I can get a good residency spot, because I'm not going to compromise on the excellence of my training. So I
Mm.
said, if I can get a good residency spot in New York, I will. But I was super afraid of the malignant reputation that New York hospitals had. But fortunately for me, I had an intern when I was in med school who was then in San Francisco. That was like, well, there's a West Coast program on the East Coast. It's called Mount Sinai. And so that's how I found out about the Mount Sinai Hospital in New York City. I applied, I got in. One of the best decisions that I made in my life was to do that. And living in New York for 3 years was great. And I was happy to leave away from all the rats back to California. Oh.
Right. So you've gone across to New York in a hospital that you'd chosen, but it's still a whole team that you didn't know. Was that easy?
Absolutely.
What
Oh
happened?
gosh. You know, it wasn't easy, but if we think about what a lot of us do, we decide what we want and we do what we need to do to achieve what we want. And then we find the support along the way to help us succeed at what we want, right? So it wasn't easy. Actually, it was really hard. And part of what made it even harder was when I was in medical school, my siblings and I lived together. So I went to school in San Francisco, but I lived across the bay because that was cheaper. So five of us, including the youngest of us that was in high school. So for me, making the decision to move across the country was hard because it wasn't just about me. It was a fact that there were people that I was financially responsible for, right? My student loans was going towards us making sure like the lights was on.
Mhm.
The high school kid, we did not want them working. We wanted them to focus. She was an athlete. So making sure that people were actually thriving. So moving across country was hard from that perspective because there was that guilt of I was leaving my siblings.
Mm.
I did end up taking my youngest one, the one that was in high school. I took her with me when I moved to New York because, so that she could stay with me and, be motivated and all that stuff. And I'm glad that we did. She still lives on the East Coast till now, but it wasn't easy. But there was just that knowing that it was the next right thing for me to do. And there was that trusting that even though people may not see the value of what I was doing and people did not see what I saw, I trusted that I was going to make it the best decision long term. And that's exactly what I did.
Yeah, that speaks to a high level of self-confidence. And maybe moving country early had an impact on your ability to look after yourself. But I don't see that as a universal skill where people are moving
Mm.
into a residency saying, I will find the supports I need to make this work.
And you have to, right? I mean, I think most of us do on a subconscious level because we make the decisions we make because we believe that it will work out, right? And part of that working out is finding like the ropes we need along the way. I think most people just don't think about it, but there's that belief that there's something that's going to help keep me afloat. There's something that's going to help me excel. And when we get there, we look for it. And I believe that when we look for it in the right places and we don't give up, we will find it. It wasn't all easy, right? I mean, I had quote unquote baggage. I had a younger sister that was living with me. Two of us were like surviving on my resident income in New York City, in Manhattan, right?
Mm.
So I had responsibilities that some other people may not have had. So I could not find people that related to where I was, right? I
Mhm.
could not go bar hopping after work. Right. I could not go like splurging on holidays because I didn't have the finances to do that. I probably would have, I probably would have qualified for like aids in New York and like government support. But I was too busy to even look for all that stuff and had a lot of pride, to be honest with you, knowing that this was short term and that in the long term I was going to be okay. So I do think that it was hard to find my support, but I found it because I believe that I would find it. And the few people that I do have from residency, we still stay connected. In fact, one of them, we met up in Cyprus with our families and enjoyed like a 5 day in Cyprus during our sabbatical.
Nice, nice. Okay, so I know that you find the ropes to help you and the supports. And I think that you're right. It's something bigger than you. You had a sister who was relying on you. And so this was bigger than you. But still, the thinking and that intentional mindset, if we call it that, of saying, I will figure this out it's like there's no other option than to figure it out. That tenacity and that optimism that you will find your supports is not a universal skill. In fact, we have quite the opposite thinking happening for a lot of our residents, junior attendings, and even within our senior years, of feeling like everything's against me, nothing's going to work out, that negative spin thinking. But you came into it with this, I will be figuring this out and I will be finding my supports even when it's hard. I know that you're thinking that everyone thinks that. It's not true.
No, thanks for pointing that out. Thanks for pointing it out because it's part of how we're raising our kids even now, right? A lot of times I teach my kids to solve problems, right? I teach them that to be resourceful, right? And so that's been one of the beauty of the sabbatical is I have the time to let them struggle a little bit more. I have the time to not try to solve their problems quickly, right? And part of it is because I do believe that it's important for them to be resourceful. It's important for them to know how to find the support that they need, and also remember that I'm not meant to be the only center of their world. Like we want them to know that they have a community that they either already know or they may not already know, but they can create, right? And it's based on the belief that it will all work out. I will do what it takes to work out. But I do want to say something because I think thanks for pointing that out. But I think that people listening may think it's all positive. I will say that now that I'm a coach and I understand and I'm evaluating my thoughts a little bit more, part of what has driven me has not always been something positive.
Mm-hmm.
Part of what has driven me has been my fear of regret.
Mm.
Okay. My fear of regret has been my biggest motivation. I live my life. I mean, it's not, and negative emotions can be hurtful or can be helpful, right? So for me, my fear of regret is why I'm taking a sabbatical. My fear of regret is why I'm a good doctor, because I don't want to regret not giving my best to every patient to the best of my human ability, right? My fear of regret is why I decided to stop being afraid of my finances and actually learn how to do my finances, because I'm like, so many people sacrifice so that I can be where I am today. I don't want them to regret the sacrifice that they made. So I think it's important to point that out because it's not like it wasn't always the positive outcome that compelled me. It was my fear of a negative emotion or a negative thing or feeling that I could potentially have that. So yeah.
Interesting. That's very interesting. I want to pull something out of there that you just said. So I want to do the best for my patients. How do we balance that when you've got a family, when you've got resident responsibilities, and you can't spend 5 hours with a patient giving them your best till they understand to the nth degree? So where does the balance come in there?
Absolutely. When I say the best, I think this applies universally, not just in terms of time, but also money. And I'm bringing that in because I want to make sure that people are learning in different ways from our conversation. So
Mm-hmm.
I think about things as quality, not just quantity.
Mm-hmm.
My best for a patient doesn't mean I spend an hour with them. In fact, when I spend an hour with a patient, it means that I'm not going to be the best for the next patient.
Mm-hmm.
But it's quality, not only quantity, meaning that I can literally spend 5 minutes with you, but I'm here, I'm present with you. And that's the best, right? And sometimes the best is the best that I can give today, right now, on this day of imperfection, where I have an over crazy schedule, right? And so the best I can give today is the best I can give today. And there are times when my brain comes after me and my brain is like, well, you didn't give everything. I'm like, you know what? Today is just a day where part of being the best is deciding when I'm going to do a shitty job. And today's the day that I just get to do a shitty job. So thanks, brain. I'm just going to do a shitty job today, but not a shitty job in a horrible way. But a lot of our physicians, right? Our shitty job is still like an amazing job. We just judge ourselves so much. So it's about quality, not quantity. Most times we think we're out of time. And for that reason, we're like, our minds are in different places. So it actually ends up wasting our time. Because instead of spending 5 minutes, it's 30 very unsatisfactory minutes. But I can say, you know what? Nothing else matters in the world except for Miss Johnson in front of me right now. And Miss Johnson, I love you. I wish I had all the time in the world to spend. I only have this amount of time today, but I bet we can make it the best time we've ever had. So let's talk about how I can best help you during this time so that we can take care of you and you'll be well by the time we leave here. And we get to do that together. So part of it is the trends being transparent with our patients so that they understand the truth of how the healthcare system is right now, the truth of the fact that I want to sit down here and grab a cup of coffee with you and we can just sit down and just enjoy our time together. But I cannot. But because I cannot, let's take care of why you're here. And, at the end of the day, we're all just trying our best, but it's not about quantity. It is always about the quality, in my opinion.
Got it. Okay. Because that's a good understanding that we have a huge volume of people trying to access care, and we've got just a finite amount of you, and we need to spend you wisely.
Absolutely. Absolutely. Right. And there is a best for the patient, and there's also now like the best for our lives. And that's why it's important for us to think long term in that regard and not spend every microsecond of our best outside of our home only, because our home also deserves some of our best. So there are times when my best is like being a 75%, 77% good enough physician so I can have something that's left so I can actually enjoy and give to the people that are going to be my support outside of the clinical room as well.
Got it. All right. Talk me through moving into your attending jobs, moving into that space where you're no longer dictated to by the forces of residency. Where do things happen then? Well, how does it go?
So when it's always interesting how things work. When I was finishing up my fellowship, I knew that I had an interest in IBD, Crohn's, and ulcerative colitis. I knew that I did not want to work for academia. And so I wanted to work for a large hospital system. And fortunately, there was one that I liked, the culture that had an opening. So that was the one that I took. And it was not easy, like a lot of people when we're transitioning. However, I'm really grateful for the place that I chose to work. They are really, really supportive. And I saw that even when I was interviewing, where the most experienced attendings would actually call anybody on the team for help. And like, what do you think about this polyp? Do you think I should remove it or do you think I should leave it and bring it back for like 3 hours schedule? Like, so there was a respect for each other's knowledge. And so I knew I was going to be supported. It wasn't going to be like the judgment that I'd experienced in training, where if you ask for help, you're like the scum of the earth. How dare you not know how to do this since birth? So it was a better, safe environment for me to grow and thrive. And it was one of the best decisions that I made. So I had that knowing that I was going to have that support so I could actually be my best. And from day one, because of my expertise, even the most experienced people were asking me for help. So that definitely helped me build my confidence, even as an attending. And that's where I was until I chose to take a sabbatical. And best decision that I made, best colleagues, best teams, which made it super hard to leave when I did as well. But sometimes you have to do the hard things so that you can create what you want.
Yeah. What about things like staff that you're working with, not just the physicians, and the access to you? Because it sounds like you're going to get a lot of fielding of calls from your colleagues if you're going to be an expert in an area, in a place where you ask for help. Tell us about that.
Absolutely. One thing I try to remind myself is to be honest with kindness. Not honest and being a jerk, but honest with kindness. So honest and kind is, can I find you when I'm done charting? Can I find you when I'm done with this stuff? I don't want to lose my train of thought. That's honest. Being dishonest is when everything is an inconvenience and we don't communicate that. That's actually not being honest, and that's not being fair, and that's not being kind to the other people. So that was what helped me a lot, was being kind and honest and being respectful, regardless of who it is, regardless of what part of my team it is. So that was really helpful. Working with our team it was interesting because when I joined my practice, they hadn't had a lot of women in the past. A lot of their GI docs were like men, white men, older white men at that point. So there was that, and I look young. So there were times when the nurses were a little bit odd about that. But, unfortunately, as someone that's witnessed discrimination for a lot of my adult years, I knew how to stay focused on the main thing. And the main thing was my patient. I also had boundaries that I was very, very clear on to myself. I did not have to communicate those with anybody. But if you're going into a place and a community where most of them are men, physician or male physicians, and a lot of the staff, admin staff, were women, there's sometimes that culture of nurturing the men. And when you, as a female physician, now comes to that practice, people think that you're going to continue nurturing people. And so one of the decisions that I made early on was someone had said, you don't even bring us snacks. And I made the decision that I was never, ever going to bring snacks because anybody expected me to. I'm here to take care of my patients and be kind and respectful to my team. And that was important to me. And that's what I did. So there were nurses that would tell me that other nurses would say things like she doesn't even laugh. If you want to work with her, you have to make sure like you are, she doesn't like play around. And I'm like, yo, if I'm fixing a bleeder, I'm here to fix that. Like if your mother is the one on the table, you bet your bum I'm going to be as serious as this. But I think being clear about what I was there for, choosing love, kindness, respect for everybody really helped me long term, because at the end of the day, many of them chose to get their care from me, right? I literally, when I was taking a sabbatical, there was someone who had been deferring getting her colonoscopy for years because she was afraid. And she was like, since you're taking your sabbatical, since you're leaving us, I better get my procedure done quickly. Like, so be like, it's hard in the short term to be you, but we have to learn to trust that we know what we're doing. We have to learn to trust that some people are not going to be happy about it. And that may be the most honest, kind, and respectful thing you're ever going to do for them, is let them have that. And, I cared about my team. I would ask our nurses, how are they doing? Many of them would actually, they want to work with me because they're like, working with you is like a therapy session because you really ask how we're doing and you care to know how we're doing. But I'm going to do that on my terms, understanding like my time restriction, understanding that I'm not going to choose to stay outside of work or come in early to do patient care because my time outside of work is also important to me. So knowing my boundaries, being clear about it, and finding ways that I can also optimize and utilize the time that I had with my team. Again, quantity over quality is always important, so that when they're there, I can really care about them and go, how is your son doing? How is it doing with transition to, high school? Like really genuinely caring about people. When you do that, it's not going to be the amount of time that matters. It's how people feel when they leave you that matters. And we can do that even with limited time to an extent.
Mm-hmm. Got it. Okay. That's very helpful, because I think it shows that even though you were looking for a place that was supportive, you weren't necessarily looking for people who look like you, which is fascinating.
Yeah.
And you're able to maintain your own boundaries within that system, because I see a lot of that difficulty as people move into that attending position and how to find their feet and find their floor. Yeah.
Absolutely.
So
Absolutely.
helpful.
It's not
So tell us
always
about
easy,
taking a
but it's
sabbatical. So it
doable.
doesn't sound like it was it's not easy taking a sabbatical. Were you somewhat fearful there about losing how to kind of tie up your patients, look after your patients, and also create this space and the coming back to a career?
Absolutely. There's always going to be fear. Whether you take a sabbatical or not, there will be fear. Just so you know. So if you want a sabbatical, you might as well take the sabbatical. Because even if you don't take a sabbatical, the fear, you're still going to feel it. It's just going to be a different circumstance that causes the fear. But the idea about the sabbatical is not something that I'd planned in advance. I did not. If you asked me 2 years ago, I had no plans of sabbatical. I loved my job. I loved my people. I literally have some of the best patients. Like, I still miss my patients, and that's the truth, because I'm so grateful. Not all of them, right? Because no one is going to be, there's no one that's going to be perfect. I'm not perfect, they're not, but I'm so grateful for the patients that I had. So the comfortable thing to do, I loved my patients, I loved my team, not just my colleagues as in my doctors, but like our nurses, our medical assistants. I love my MA and all the stuff, right? The comfortable thing to do was stay.
Mhm.
However, literally a year ago in August, this was like 6 months before the sabbatical, was when I had gone to give a talk in Aruba. And my husband went with me for the conference. And we were impressed by the languages that they spoke there. They spoke many languages. And I was like, look, imagine what happens to the brain when your kids get this kind of exposure. How amazing would it be to live in Aruba for 6 months? And I was like, but we don't do stupid things like that. That's kind of crazy for crazy people. And then I went back to my work. And my husband is an IT consultant. And then about a month or so later, my husband was like, "Oh, I'm ready." I'm like, "Ready for what?" It's like, "Oh, that thing." I'm like, "What thing?" The sabbatical. I'm like, I was joking. I'm a freaking physician. We don't do that, right? And then I just went away. But there was just this nudge that I had in my mind and my spirit, like it was the next right thing for us to do. And so that was something that I had to trust. I had to trust that almost like that inner calling, if that makes sense. I had to trust that like desire, that pull, like I see if that's what my journey was meant to evolve into next. And so, at that point, our finances, we already have our finances in order because of the stuff that I tell women physicians to do, period, regardless of whether they want a sabbatical or not. So money was not the reason why I was not going to take a sabbatical. It was going to be those other things. And so I remember everyone I told my chief, poor guy, I called him into my office and I was like, I was like, close the door. This is serious. He's like, what? I was like, I'm leaving. And he staggered, held a chair, and sat down. I was like, Latifat, what did I do? How can we make this right? Right. Those are the caliber of people that I worked with. Right. So they are people that I loved, but I just had to trust again. And I think this is something that I believe that many people can learn to practice. Yes, I am a person of faith, but I don't think it's isolated or restricted only to people of faith, but you can believe that things maybe work out for good. And a lot of times we can look back at our lives and find evidence. And there are times when I had to literally do this, where I looked back at my life and looked at the things that I did not plan in advance that made life better than I could have anticipated. And making that list created evidence for me of the fact that even when I'm not, even when I don't have like it's not a pre-planned thing that I planned forever, even though I don't know with certainty how it's going to work. I have evidence in my past of things working out better. Of course, there are things that worked out once, but because I knew the plan worse, but because I knew what I wanted, I created evidence to help me make that decision easier. So that's what led to the sabbatical. So I took the sabbatical about 6 months after I decided that I wanted it. And we said we're going to take a year off. I had to quit my job. They could have kept my position, to be honest with you, but
Mhm.
I felt that nudge in my spirit, in my mind, that I did not know what my life was going to look like after I came back. And I did not think it was fair to lag them on or tag them along. And then if my life changed during the sabbatical, if my mindset changed, if I had better clarity about what I was going to do with my life, then to now tell them, sorry, I did not think that was fair. So I had to end our relationship knowing that if I wanted to come back, I would just apply again and be at but there's abundance, there's always jobs, there's always opportunities, and I know how to create money. We'll be fine. Those are the thoughts we all have access to, and we can
Mhm.
practice, find the evidence for how those thoughts may have been true for you in the past, and practice it over and over and over until you believe it so much that you're able to take the action. Fear is never going to go away. I think it's important to emphasize that. And even for someone that had their financial house in order, that definitely helped. But it's not like there's zero fear at all, but it's just like low volume, maybe like 3% volume as opposed to like 100% volume that it would have been if I did not have the things that I had in order.
Mhm. Yeah, certainly we see physicians feeling trapped in medicine because of that financial stress and financial strain, for sure. How do people find you if they're looking to work with you or learn more about how you got your finances in order?
Absolutely. They can go on my podcast. If they're listening to this, they're already on a podcast platform. So they can go, it's called the Money Fit MD, which is a podcast. I share about 2 episodes a week. Sometimes it's solo episodes, and other times it's like fabulous guests like you. And sometimes it's like women physicians that are doing amazing things in their finances, primary care doctors, pediatricians, like the whole gamut, and how they've been able to do their journey. So that's an easy way to find me. But they can also find my book, which is available on Amazon. That's called Done with Broke, The Woman Physician's Guide to More Money and Less Hustle. And, I'm also on Facebook and Instagram, MoneyFit MD. It would be a pleasure to connect with any physicians that needs the support that I have available.
Wonderful. And anything we didn't talk about that you wanted to leave as a message for the people listening today?
I think if there's anything that I'm going to share to your audience, it is that it is easy to hear me talk, and maybe some of the other guests you've had on your podcast, and assume that they had it all figured out. Having it all figured out is a retrospective conclusion. When we are in the process, we feel exactly the same way you feel. We feel uncertain, we feel afraid. And what we do, though, is we learn to find the tools that we need. So the tools we need could be support, could be mentorship, could be coaching, could be financial education, but we get the tools that we need. And that is what helps us get to the point that we're in right now. But, everything you want is possible for you. And that may sound cliche, but I really mean it. We didn't talk a lot about my financial journey, but I did not know anything about money until literally 7 years ago. I knew zero. Like, I didn't even know what a freaking 401k budget, nothing like that, right? But this is the stuff that I've created through intentional doing the work that I've done over the last couple of years. And I know that if you're human that is bright enough to be a physician, I promise you can find your own way too. But just make sure you reach out to those that can help you. And we're here to support you along the road.
I love that. Thank you so much for being here today. And I just look forward to hearing about your adventures. And maybe that's book number 2. It's how to have a fantastic sabbatical.
We'll see. All right. Thank you for having me. And thank you for what you do. What you do literally gives physicians their lives back. And it is so important. So thank you for doing it.
Yeah. Perfect. Have a great week, everybody. Thank you for being part of the Sustainable Clinical Medicine podcast. If you'd like to learn more or join us to help you get home with today's work done, go to chartingcoach.ca. There you'll find all the information on the premier Lifetime Access Charting Champions program that is helping physicians get home with today's work done, with all the proven tools, support, and community you need to create time for your life outside of medicine. We would love to see you there. Until next time, thanks for listening.